Welcome to this session on venom allergy, what you need to know about bee and ant allergies. My name is Dr. Alice Hoyt. I am a board-certified allergist with the Hoyt Institute of Food Allergy, and I'm delighted to be giving this presentation for the Code ANA program. Quick disclaimer, this content was created as an educational resource and is not medical advice. This content was created by myself and I grant Code ANA full permission to use this content. After this quick session, you will be able to, number one, list the common causes of venom-induced allergic reactions, and number two, describe how to respond to venom-induced allergic reactions. So what really is a venom allergy? When we're talking about a venom allergy is a life-threatening allergic reaction to a venom. And what really is a venom? A venom is a poisonous secretion from an animal, such as that from a honeybee or from a fire ant. Here you see common venom allergens. These are divided based on how related certain species are to each other. And you see we start with Hymenoptera and divide the groups into ants, bees, wasps. And with ants, some of the most common venom allergens are fire ants. Within bees, our honeybees are common allergens. And then within wasps, specifically vespids, paper wasps, yellow jackets, and yellow hornets are the three most common venom allergens of the wasps. Do note that it is very hard to identify different flying venomous insects. And so if you know someone is allergic, you should just stay away. When we're thinking of venom-induced reactions, there are three groupings of reactions. Not just allergic reactions, but just different types of reactions. One type of reaction is a local reaction, and that's a very common reaction, and that's where the inflammation is really just limited to the site of the sting or the bite. There's anaphylaxis, which is a severe allergic reaction. That is a system-wide reaction, and this can be life-threatening. And this is when, say, you're stung in your arm, but then you're having hives and swelling well beyond your arm, all over your body. And one of the things we get very concerned with venom allergy is that you can be stung and very quickly develop symptoms of anaphylaxis, such as that drop in blood pressure, which is why it's so important that anybody who has a true venom allergy see an allergist and have an epinephrine auto-injector, because you never know when these little guys are going to sting you. And the third type of venom-induced reaction is a toxic reaction. And these are relatively rare. They're more delayed in onset, and they can involve kidney inflammation and other systemic issues. If at any point you think a toxic reaction is going on, just like with these other types of reactions, the person needs to seek medical attention. And what might some of that medical attention look like? When we're talking about managing local reactions, typically supportive care is all that's needed. And these insect stings, they can really be very uncomfortable, but if somebody has a very localized, even if it's very large swelling, that is still considered a local reaction. What about anaphylaxis? How is that managed? Anaphylaxis really must be recognized promptly and treated with epinephrine. This person, of course, should be evaluated by a physician immediately. And you see there are three definitions of anaphylaxis. Important to note, especially when we're thinking about venom-induced allergic reactions, is that these reactions can occur very quickly. And some people might not even have any sort of hives or swelling, but they can very quickly have a drop in their blood pressure. And this again is why it's so important that if somebody has a known venom allergy, that they do carry an epinephrine auto-injector with them and have others with them in their party who know how to use the device. And moving on to that toxic reaction, how is this managed? Suspected toxic reactions are managed immediately by a board-certified physician. So to recap, what you now know are the list of common causes of venom-induced allergic reactions, and then really how to respond to those venom-induced allergic reactions.